you for that very kind introduction. Good morning to you all, and thank you all for being here. I congratulate LEXPRISE and IJASRH for organizing a webinar on this extremely relevant and topical issue. I am going to begin with some basics. These are important, even self-evident, but are often forgotten. First, every government action needs to be backed by a law. Without legal backing, government cannot act. So, when you hear someone say, why can't government do this? Why can't government do that? It will do good to verify whether there is a pre-existing enabling law. Second, the purpose of all law, or its more familiar cousins, acts and rules, is not to be legally elegant but to facilitate practice. Therefore, when we assess the performance of the Disaster Management Act, the touchstone is not ideology but relevance, utility, and convenience. In short, the proof of the Disaster Management Act pudding lies in the eating of implementation. Third, referencing the Disaster Management Act alone in the Covid-19 response would be an incomplete exercise because the Disaster Management Act, the Epidemic Diseases Act, and the IPC 1860 in tandem have been the principal legal tools that our governments have leveraged in fighting the Covid-19 pandemic. I just wanted to articulate these three premises up front so that we stay on course. It is strange and surprising that the Act is so young, enacted as recently as 2005. It is just 15 years old. To jog your memory, India faced catastrophic natural disasters such as the Gujarat earthquake of 2001 and the Indian Ocean tsunami of 2004 without an overarching legal framework in place other than that archaic colonial relic of the Famine Code. The enactment of the Disaster Management Act did several important things. It created an overarching legal framework. It was pan-Indian in scope, thus bringing uniformity and standardization of response. It replaced the relief-centric approach of the Famine Code with one that emphasized proactive prevention, mitigation, and preparedness. And it created a multi-level institutional setup that the center, the states, and the local authorities, including the districts, were all covered. So, before we knock the Act itself, let us understand that it has enabled not just the 4,000 plus orders and circulars reportedly issued by the union and state governments, but also created a mechanism for their implementation all the way down to the district collector. It has also enabled us to rapidly put together a vast battalion of field level workers, doctors, ASHA workers, revenue staff, police, civil defense, NSS, medical and computer technicians, all working together, sharing information, pooling resources towards a common cause. Does the Act have shortcomings? If so, therein lies a responsibility to recognize, acknowledge, and correct. Going back to my initial remarks, the touchstone of the efficacy of a law is whether it facilitates practice. Therefore, we need to focus a critical lens on the deficiencies that come to the fore while we formulate and execute our response to COVID-19. So let us do a reality check. The first touchstone is the Act's adequacy. Though the NDMA has formulated guidelines on management of biological disasters in 2008 and the National Disaster Management Plan in 2019, both of which deal extensively with biological disasters and health emergencies, states still found it necessary to invoke the Epidemic Diseases Act, a pre-independence legislation, and also various state-specific acts to deal with the pandemic. Also, The implementation of the lockdown saw the invoking of Section 144 of the IPC. Is this because, despite being an umbrella framework for dealing with all disasters, the Act has been mostly envisaged as an instrument to respond to calamities such as floods and drought, more familiar in our subcontinent than an unprecedented pandemic such as Covid-19. In fact, Covid-19 is the first pan-Indian biological disaster of this scale being handled by the legal and constitutional institutions of the country. This is also the reason why some have argued that India needs a separate legal architecture to deal with public health calamities. Whether we need a separate Public Health Act or we need to expand the scope of the Disaster Management Act is something I would expect today's session to deliberate upon. The second touchstone is ground level implementation. The effective implementation of the national and state decisions under the Disaster Management Act is dependent on its efficacy at grassroots level. Here, the district administrations and local self-government institutions remain its best bet. Much before Covid-19, the Act has been criticized for not providing enough scope for NGOs and non-profits. When the plight of the migrant workers shook our collective conscience, this apparent exclusion took on greater emphasis in public discourse. At the same time, I know from personal experience that my NSS volunteers, for instance, were able to work effectively in the field at grassroots level. How could they do so? At the very outset, even before Lockdown 1.0, we instructed the NSS that they would be on standby mode and available to district administrations for any services called for. Next, we co-opted the NSS officers and coordinators, who are all university faculty, with a training session in coordination with the National Health Mission, again as early as 23rd March 2020. Then, throughout the lockdown period, we educated and motivated the NSS cells through a series of informative educative video sessions and webinars in coordination with LIMAS and the Rajiv Gandhi University of Health Sciences. These sessions became hugely popular with medical professionals, non-medical professionals, and even NSS members outside Karnataka. We also have anecdotal evidence in the media that some individuals rose to the occasion and provided migrant workers with food, water, transport, and the like. The point I am making is that the Act is not exclusionary in intent or purpose. It does not actually prohibit voluntary work, but it does demand that for effective functioning, the voluntary mechanism works in sync with and perhaps under the directions of the district administrations and requires close coordination with governmental and the medical establishment. Where this coordination could not take place, ground level synchronization did not take place. So the question for deliberation, should the Act be so inclusive as to allow for independent functioning of non-governmental organizations, or is this a risky proposition in times of crisis? This is a question the forum may find interesting. The third touchstone is again related to the question of coordination. The Act is hierarchical in design. Its unstated premise is that the subordinate agencies will carry out instructions of the superior agencies and that information flow from below to above is optimal. The federal structure like India, complicated by contextual dissimilarities of geography, leadership, and the curve of the disease itself, such assumptions are dicey. Biological disasters of a national magnitude necessitate close administrative and political coordination of the union and state governments, the disaster management authorities, and all other stakeholders, including the people. To be fair, as per the mandate of the Disaster Management Act, a concerted effort is required to ensure that these bodies are administratively, politically, and financially empowered. In the true spirit of the Disaster Management Act and federal structure, national and state political and administrative agencies have necessarily to be more collaborative and consultative. But the report of the task force to to review the Disaster Management Act in 2013 suggested that the present structure of various authorities under the Disaster Management Act is not conducive for carrying out the tasks it has been mandated to perform. For instance, in one state at least, we found that panchayats had to be empowered to purchase masks, sanitizers, and so on. Why was this even necessary? Issues like the movement of migrant laborers, availability of food, arranging livelihoods to daily wagers, relief camps, entitlement of statutory minimum relief, and so on, that directly affect millions in this country need special attention. They require flexibility, iteration, and ready action. They require pre-existing robust mechanisms. Does the DM Act require a tinkering for a more democratic and empowered functioning at all levels, or is this correctable at the implementation stage? In other words, does this imperative require structural, institutional, or practical address? This is something we can discuss about. The Disaster Management Act is far-sighted, robust, and a comprehensive piece of legislation. It may not be infallible, but it is certainly correctable. I have pointed out some areas of potential interest, and I am sure you will find others. With these words, I wish the deliberations in this forum all success. Thank you.